So we'll move right along to our first speaker. So I'd like to introduce you all to Dr. Paula Margozzini, who is a public health and epidemiology professor at Pontificia Universidad Católica de Chile. I hope I'm pronouncing this okay, apologies. She works as a clinician in an adult family medicine. Her research has focused mainly on chronic disease prevention and surveillance. She has worked on the 3 waves of the Chilean National Health Surveys and was a director of the Chilean Alcohol Social Cost Study. She also works as an advisor and consultant for the Chilean Ministry of Health and the National Alcohol and Drug Prevention Agency. Today, she will be presenting on alcohol consumption during COVID-19, a natural experiment for alcohol policy in Chile. So I'd like to hand over now to Paula. Thank you.
Thank you very much, Andy. Nice to meet you all, and thanks to ICARA for this opportunity to share and discuss with colleagues around the world on alcohol topics. So first of all, I would like to say a couple of words that could make you understand the context. Maybe you're not familiar with Chile in particular, in the southern cone of Latin America. And in short words, we have, as many Latin American countries, a huge public health problem around alcohol consumption. About 1 out of 3 high school children in Chile drank the last month, and 2 out of 3 of them had a heavy episodic drinking, intoxication. 12% of our population, 15 years and older, has an audit screening positive, and over 20% of men have this risky drinking. About over 9 liters pure alcohol per capita year, and with a clearly predominant heavy episodic drinking pattern. Our Chilean standard drink is 15.5 grams. And our last update on local study of burden of disease and social costs gave us 13% of attributable deaths, a lot of DALYs, and $2.2 billion of social costs, which is in particular important to cite, is that these costs are 5 times higher than our actual alcohol tax revenue. And this is a very conservative estimate. So this is what Chile faces around alcohol, but we are very fortunate to have lots of information, and we have had past and present government authorities that have been quite sensible to epidemiological surveillance. So we have a lot of data, and this data has been very effective, slow, not as fast as we would like, but very effective in pulling through and stimulating a good policy. So if you look at the best buys around an alcohol policy, safer strategy, we can say that in Chile we have advanced a lot with enforcing drink and driving. We have a lot of work on brief interventions and treatment. And recently, just 2 weeks ago, we have this new law which enforce bans and comprehensive restrictions on alcohol advertising, sponsorship, and promotion. No more football and alcohol in Chile, and we are very, very happy about that. But there are two aspects about restrictions to alcohol availability and about prices that are still very, very important, and we have a great delay in policy. We haven't been able to enforce these 2 aspects. quite important in Chile is the price issue, because our local spirits bottle is 4 euros, okay, compared to, I mean, Iceland, where that bottle is 84 euros. So we have big problems with this two type of policies. And COVID pandemic, this terrible pandemic, has given us the opportunity to study and learn more about alcohol consumption in our country, because precisely this terrible pandemic has had consequences, population-wide consequences, on alcohol availability and also on price. So what I'm going to share with you is some data coming from studies done during COVID pandemic in Chile. And we are thinking, our team was thinking about this hypothesis. We can say that COVID curfews and confinements can be considered as alcohol interventions in availability. And COVID economic shock that has been huge in Latin America could be considered an increase in alcohol's relative price, because people are less wealthy. So we suppose our hypothesis is that alcohol consumption would decrease. So we wanted to describe change in alcohol consumption availability and purchasing behaviors during COVID-19 and discuss possible explanations and implications for public policy. Methods around this is a very important online survey done during COVID-19 long lockdowns. This study was done by our Alcohol and Drug Prevention National Agency during the pandemic. And as you can see here, we have the epidemic curve in Chile, and you can see two big waves, one going around June of 1920 and one that has just ended now, and we are very happy, that is around April, May of 2021. So our prevention agency, which is called Servicio Nacional de Prevención de Alcohol y Drogas, SENDA, made the service around those dates. So what we have done is secondary analysis of this public database about the survey. The survey used some kind of standard questions based on the European Drug Observatory web survey. They were set on websites, so we have no clear denominator. We can't construct rates or prevalences, but we can see somehow perceived of self-reported behavior change. So 34,000 people answered this survey, and we validated some of this information. There were some quite more women in the sample, and as you can see here, fewer elderly people, as was expected for a web survey. So what did we see? We have self-reported alcohol consumption change here by age. And what we saw is that most people in Chile either decreased their alcohol consumption or maintained their consumption, okay? So 43% of people decreased, and there was this parallel phenomena occurring in a subgroup, which was 20% that they referred that they had increased. okay? And the most important thing is that the biggest decrease in consumption has occurred in young people. You have the decrease in blue, okay? So over 50% of people around 15 to 29-year-old, they reported a decrease in alcohol consumption when they compared the COVID lockdown waves, comparing to their previous consumption. So all age groups had a decrease in alcohol consumption, as you can see the blue bars, and but mostly young people had the biggest decrease. And there was a somehow around 20% increase in a subgroup that increased in all age groups. This is a significant association. I'm trying to change the slide, but I think this is somehow okay. Did the slide change? Yes?
Yes.
Okay, so self-reported change in alcohol consumption during COVID by gender. And here we can see that both women and men had this over 40% decrease in consumption. But when you adjust by age, you can see somehow a bigger decrease in men when you have a logistic analysis adjust by age. And what about self-reported causes of decreased alcohol consumption? And here I can show you different causes because they are clearly different between younger people and elder people. So the economic reason was present in both groups. About 20% said they had lost income, less money to buy, or they were saving money due to future financial uncertainty, okay? But mostly young people had difficulty in access and consumption opportunities, okay? Difficult to buy or due to reduction in ability to obtain because they cannot leave home, or because, very important, there were fewer opportunities to consume, okay? Instead, elderly people, they had a higher percentage of people that answered that healthcare issues were the cause of their decrease, because they are concerned about the effects on their health, okay? So there is different reasons. And here we have some, oh, sorry is this, some causes of the increase. The subgroup, this 20% people that increase their consumption, we have the causes here. And mostly both groups, younger and elder people, talked about psychological reasons. And I note that psychological reasons, these groups included boredom, okay? Boredom, or because of anxiety, stress, depression that COVID generates in them, okay? And they also had more time, okay? And they, the time issue, having more time was an important, very important cause in over 60-year-old people. There. So there was also change in alcohol purchasing behavior. Self-reported change in the way to obtain alcohol beverage during COVID-19. Here we have people who changed, and they say mainly they changed frequency, okay? They stocked. They also changed place, 1/3 of them. And there was an important increase in internet purchase. 22% had this big change, including internet purchase, okay? And this was seen in all age groups, mainly 30 to 59-year-old people. I note that in Chile, the industry had a very, very fast adaptation to this crisis. So we had a lot of internet issues around selling and advertising around alcohol. So we saw change in availability and price of alcohol. That this kind of change were kind of a natural experiment going around this shock, this COVID shock. Of course, we don't want this kind of shocks to occur to the community, so they can drink less alcohol. We don't want that, but we have learned that change in availability and price in Chile, in less developed countries, could have a great impact in consumption, and this impact could be even higher in men and young people, which is important because those groups are the people who have highest risky drinking, okay? And this change, something that is very important, is that this change is very, very fast. You know, we have had about 14 years of delay trying to regulate advertising, alcohol advertising in Chile. And this will have an impact in future decades. But this kind of impact is as fast as a monthly days of impact. So it's very fast. And findings are quite consistent with the national experiences published during COVID. Sila Sanchez, who is presenting now, also had a participation in a Pan-American Health Organization Southern Cone study, and which they find some consistent general consumption went down, and also binge drinking they found that went down. Europe has shown a kind of a less magnitude of decrease, but they also have this double pattern of decrease in some groups and a same amount of 20% increase in people. And this 20% increase that was found in Chile and other countries is very much related with mental health issues. People, subgroups of people that cope their mental health issues drinking alcohol. And we also might say that the magnitude of decrease that we have seen in Chile may have been attenuated by pandemic stress, because pandemic stress will increase alcohol in people who cope in that style. And also this has been this decrease has been mitigated, attenuated by the fast strategies, adaptation strategies of the alcohol industry, mainly by online sales and advertising. So what we are now thinking about policy implications and would be our Chilean next steps. We would certainly like to work on regulation of web advertisement and internet sales, which we have no kind of regulation. And we would like to reload discussion on sale hours, number and type of sales stores, availability, density of licenses. And we would also like to reload the tax increase discussion in Chile, mainly because of this COVID opportunity, with this economic shock in which we are, we really need our government needs money and taxes for development. We cannot afford a 1% per capita income going down because of alcohol consumption of our population. And we certainly are supporting, we have a specific strategy in Chile that is related to the Iceland youth program, in which we are supporting youth access to supervised, structured, free time use, because this issue about boredom and time and free time use is very much important and related to alcohol consumption, alcohol and drug consumption, and in the population. So thank you very much, and this is what I would like to share with you. I had another slide, and that was just to share with you our happiness about this long road we had with our parliament and discussions, 14 years of a long road of discussions in the parliament to get to this point in which 2 weeks ago we have new alcohol labels in bottles, and we have banned advertisement in sports, and also more fees for sales to children, and several other regulations. So just happy to share this with you, because things can go better with policy when there is evidence shared.
That's great. Thank you very much, Paula, for that. And congratulations on getting to that milestone so far. I think we have time for maybe 1 or 2 questions, if anybody does have any questions. Also, as the speakers are talking, please do feel free to post any questions in the chat as well for those of you who have just joined us. So welcome. Does anybody have any questions for Paula? Hi, Ian.
Yeah, I wasn't sure I got a picture of what people were drinking, wine, spirits, beer in Chile. What, I suppose we used to think about Mediterranean style drinking in Europe and Northern European drinking. Can it be characterized in those terms? Are we thinking beer, cider, wine, spirits? What types of drink was in my mind?
Okay. Well, Chile has this this particular pattern. 1/3 of our drinking is beer. The other third is spirits, and the other third is wine. Okay, that's our usual issues. And during COVID, we have not measured this in the survey, but there's information coming from the industry around and a big impact in sales, and especially this has been measured on the spirits sales. Okay, but they rapidly catched up, and sales are already going up and as usual.